Hello and welcome to the Oath and Staff podcast. I am A. David Singh, bringing you stories from people of medicine who serve humans and animals in unique and wonderful ways. A couple of weeks ago, I was checking out the LinkedIn profiles of people I am connected to when my eyes stopped at Dr. Rajesh Jacob, a forensic psychiatrist working in Singapore. There was something so remarkable about him that I immediately wanted to know more. It was a no brainer. So I reached out to him and invited him on the podcast for a chat. Welcome, Rajesh. Welcome to Oath and Staff.
Thanks, David, for the invitation. Good to connect with you after so many years.
Before we reveal what's unique about the work you do, let's start at the beginning. What got you started in medicine and later in psychiatry? Is there a story behind how you became a psychiatrist?
My family did have a medical background. Both my parents were actually biochemists, so they used to work in the lab in CMC hospital. I was exposed
Ah.
to medicine and allied fields as a child, and both of my sisters went into medicine as well. So there was an exposure there. But specifically for me, psychiatry was something which was quite interesting because we know human behavior is complex and it's not really an exact science, which made me decide to pursue psychiatry after I completed my medical degree.
Where did you train in psychiatry?
I did my MD psychiatry from Madras Medical College, and then I went back to CMC Vellore and worked with the Department of Psychiatry for about 3.5 years. And then I moved to the UK.
Which other countries has psychiatry taken you to?
So psychiatry was initially India in CMC Vellore after MD, 3.5 years. Then UK, I worked for 5 years in the NHS. And then from
Ah.
2009 onwards, I've been working in Singapore.
So I find that the best way to understand different cultures is by living and working outside one's home country. Before I ask the next question, I remember an incident that happened to me in Japan. I was confident I could navigate my way anywhere on the planet because I was fluent in English. But I was so wrong. People in Japan don't know English well. Some of the Japanese doctors also can't speak it. I had gone to a grocery store to buy bread and eggs. I found bread, but I couldn't find the eggs. So I went to the attendant and asked in my politest voice, "Eggs, please?" The woman gave me an annoyed look. How did she not know what eggs are? I wondered. So I took a sheet of paper and started to draw. Before we go any further, you should know that my drawing skills are practically non existent. So I drew a rough outline of what I thought looked like a hen and an oval shape for the egg. Then I pointed at the oval. She took the paper from me and examined it from all angles, even upside down. After a while, her look of annoyance changed and she burst out laughing. Then she guided me towards the aisle where the eggs were kept. So it was only after this incident that I quickly learnt the Japanese words for bread, milk, egg. It was a matter of survival. Since you've been working in Singapore, did you come across any language barriers like I did and cultural differences? How did you adjust to those experiences?
Fortunately, Singapore is an English speaking country. English is taught in all the schools as a first language. Only the elderly above 65 or 70 have difficulties speaking and understanding English. 9% of Singapore is actually Tamil Indian population. So I was comfortable speaking Tamil, and also I do come across Malayalis and people who speak Hindi as well. Singapore is a country of immigrants, so we do have expats from all around the world. Yes, so it's like a multicultural melting pot.
So you didn't have any experiences like me in which you had to communicate through pictures.
No, luckily not.
Rajesh, you've gone on to subspecialize in forensic psychiatry, a branch of medicine I know very little about. I know what forensic medicine is and I know what psychiatry is, but I'm not very sure what happens when you combine the two. So, first, tell us what inspired you to take up forensic psychiatry, and is there a story how you made the jump from general psychiatry to forensic psychiatry?
Sure, sure. Good question. In fact, I think in the initial part, I did mention that I went into medicine because of exposure to medicine in my family, but I also was interested in law. I used to be a good arguer. So generally, lawyers need to argue quite a bit, right, in court. So I did find the law field interesting, but at that age, when before entering medicine, I didn't really have much of information or guidance about how to do law and where to apply for. So that made my path to medicine narrower. But the interest in law was definitely there. And secondly, when crimes happen, it's important to know why do these crimes happen, the complexity of human behavior, the underlying legal principles, how people are charged in court, what happens when they are sentenced, what is the role of mental illnesses when someone commits a crime. All these factors are quite interesting for me. And forensic psychiatry is basically the interaction between law and psychiatry. So the lawyers who deal with crimes need to understand that mental health illnesses or mental disorders can play a role. Similarly, psychiatrists, forensic psychiatrists who do court reports have to know about basic legal principles. It's an interaction. So we have to work very closely with the courts and with the lawyers and the prosecution as part of our specialization.
So I believe it was your initial interest in law that drew you towards forensic psychiatry. Am I right in
Yes,
understanding that?
yes,
Ah.
yes.
What does a typical day look like for you as a forensic psychiatrist?
70% of my work is forensic, 30% is general psychiatry. I look after mainly adults in a private clinic along with six other psychiatrists. It's a 8 to 6 p.m. job. And then, as part of my forensic psychiatric work, I go to prisons. I do reports for offenders who committed serious crimes. I see offenders who are on bail who are referred to me by lawyers in the clinic, and I do medical legal reports for them. I also do mental capacity assessments, people who want to write wills, testamentary capacity, people who have dementia, issues regarding property. And then, as part of my forensic psychiatric work, I do have to go to courts as an expert witness. In fact, tomorrow I'm in court for a serious case which involves the death penalty. I do go to court quite regularly in Singapore. I also sometimes go to Malaysia, which is a neighboring country, 45 minutes away,
Mhm.
Kuala Lumpur, to give evidence there. I've been to Brunei as well.
So while we were chatting about getting you on the podcast, you had told me that you had starred on a Netflix show called Inside Crime Scene Season 2 and given advice as a forensic psychiatrist. I fired up my Netflix, but I could not find that show here in Canada. But I did find it on YouTube. It was wonderful to see you after many years, and even more awesome to see you on TV. I'll be sure to put the link in the show notes and on the YouTube channel so that our listeners and viewers can check you out. Rajesh, what prep work did you do to appear in a TV show on Netflix?
This particular episode was actually a documentary made by a Singapore film producer. It actually looks into real cases which happen in Singapore, the serious ones like murder. It was made into a documentary for the local television channel in Singapore, and then it was sold to Netflix. We did have several meetings with the producers and the directors. We had to actually go to the scene of the crime. So there was a murder which happened about 10 years ago in Singapore. We had to go there at night, recreate the scene, and give our expert opinions. I was a forensic psychiatrist. We had a forensic pathologist. We had a law professor who commented on different aspects of the case from a scientific point of view. And there were actors, and there was also a studio shooting which involved a lot of preparation as well.
So that must have been a fabulous experience for you. When I was watching it, I thought it was live. So and now I know it was not.
Yes, the cases which happened in the past years took the public's emotions. Murders were kind of uh, tragic and out of the blue. The homicide rate in Singapore is very low. Actually, it's only about 10 in a year. You can actually count them in
10
your
in a
fingers.
year.
Yes, so numbers are very low. So any murders are reported widely.
I learned a lot from that particular episode, and I was very eager to share it with our viewers. Before we reveal the unique work you do, I would request everyone who's tuning in, please mention the work you do in the About section of your LinkedIn profile. That's a great way of attracting networking opportunities and collaborations. Sometimes we are so close to our work that we may not even realize that it is noteworthy and unique. However, Others may find your work fascinating and want to connect with you. I, for one, am always hunting LinkedIn to find people who serve humans and animals in unique ways, hear their stories, and spread their stories. So, after listening to this episode, if you think you are a good fit for the show or know a friend or colleague who would be a good fit, send me an email at david@adavidsingh.com. That is David at davidsingh.com. And now back to you, Rajesh. In addition to being a TV star, you also hold the unique distinction of being a prison psychiatrist. That is such a wide departure from working in a hospital with regular patients. I find it difficult to wrap my head around it, and I have so many questions for you. But first, don't you think Rajesh Jacob, prison psychiatrist, has a nice ring to it?
Yes, yes. I think not many people are willing to work in prisons from a medical point of view. Right? So I worked in the prison. It's very close to the airport, Changi Prison. In fact, from the cells, you can see the flights taking off from Singapore airport. So it's like an irony, right? You have people locked up there in the cell, and they see few hundred meters away planes taking off, taking them to different parts of the world. So the lack of freedom, which can make somebody's detention even more difficult for them to bear. So I worked in Changi Prison for about 6 years as a prison psychiatrist, providing treatment for mentally ill offenders. I also did medical legal reports for them. Sometimes the courts will ask for reports about their fitness to undergo certain kind of programs or reformative training or probation. So we have to do assess their fitness for that. I've done that as well as part of my prison work.
How did this opportunity to work in a prison come about?
The prison psychiatric services contract was actually given to a private organization which is called the Parkway Health, which runs the main hospitals in Singapore and Malaysia. So, as part of the Parkway, we did work with them to provide the psychiatric services. We signed up with Parkway to provide those services for 6 years.
So, Rajesh, I am a big movie buff and I have seen some thrillers in which prison doctors are always in terrible trouble. Apparently, that's their only role in the film. So, were you ever in danger?
So I would say we do find that prisoners can be definitely more challenging. They can be more demanding. They can be more manipulative. They can be medication or drug seeking. In fact, 70% of prisoners in Singapore are drug offenders. They do seek medications as a form of trying to cope with their drug withdrawal or drug addiction. Dealing with those kind of people is emotionally challenging, and we have to be probably more firmer with them as compared to someone we see in the clinic or in the hospital. Secondly, malingering of symptoms is quite common as well. People who are charged with a certain crime, they may try to feign or put on symptoms of a mental illness in the hope that they may not be sentenced so heavily. Our role as a forensic psychiatrist there is to identify the malingering or the feigning of symptoms and do a report to the court to state our opinions. So malingering, picking up malingering is also quite important and quite challenging. But compared to American prisons or compared to Western prisons, the discipline is more stronger in Singapore. We don't have much of prison riots. We do have sometimes inmates hitting each other or getting into gang fight. Rarely you may have prisoners who may become violent towards healthcare staff. In fact, we've had prisoners who've thrown urine or feces at a nurse because they didn't get
Wow.
the medication they wanted, or they may spit at somebody. Physical violence in general towards healthcare staff is lesser as compared to physical violence towards other inmates or to prison officers. Prison officers provide security. So when we see an offender, there's always a prison officer in the background.
So, this was quite a challenging phase for you, and definitely certainly a different kind of experience.
Yes, definitely. Yes, it actually widens my repertoire as well. So just not just working with normal kind of patient, it also gives you scope to improve your skills in managing difficult patients and identify the different kind of challenges.
Is it possible to tell us an interesting story about a prisoner you worked with, if that won't get either of us in any trouble?
Sure, sure. Yeah, I'll probably give you an example of somebody who malingers, somebody who feigns symptoms. I did look after one particular prisoner. Initially, on the forensic assessment, he did accept to what he did. But from the third interview onwards, he started saying he can't remember what he did. And then he said that all his memory of his past events went away dramatically. There's a syndrome called Ganser syndrome. It's commonly seen in prisoners. They tend to malinger a lot. So if you ask them, what is 2 plus 2, they tell you is 6. How many legs does a chair have? They'll give you a completely wrong number. Simple questions, they would give you wrong answers. It's a form of malingering. So this guy started malingering a lot. He would say, "Oh, I don't know where I am. I don't know who you are. I don't know what I ate yesterday." But when you observe him in a neutral setting, he was able to interact normally with other prisoners. He would read the newspapers. He was cheerful. So that malingering went on for at least a few months, I would say. He was probably hoping that that would get make him escape from the penalty or at least get a reduced penalty. But every time we used to talk to him, we would tell him that this will not really help him. He has to be forthcoming with what he did. Otherwise, he would be held in remand for much longer and his sentencing would be delayed as well. So, suddenly, out of the blue, one particular day, he told me that, oh, all his memory just came back. He knows what he did. He wants a court date to be set as soon as possible so they can plead guilty and get sentenced. He was sentenced to many years in prison. So, that was an interesting case where malingering was so common and so obvious.
Now let's move back to the normal population. All of us remember the COVID years. There was social distancing, face masks, and repeated hand washing. Tough times. Now, you worked with migrant workers during the COVID pandemic. What mental health problems did these migrants face during COVID while living in a foreign country? And how did you help them?
Singapore is a unique country. It's a small country. The population is only about 5.6 million. A large proportion, about 1 million, actually are migrant workers which come from subcontinents, mainly India, Pakistan, not Pakistan, India, Bangladesh are the main sources of migrant workers. We have migrant workers from China as well. So these workers are generally housed in dormitories, usually away from the city center, and they have beds in one room. It's like a hostel. So they go to work in the morning and they come back home at night. Unfortunately, during the COVID pandemic, the first outbreak of COVID, the number of cases actually flared up in the dormitories because they were living in close proximity to each other. The vaccination had not come in at that time. So early 2020, vaccination came in 2021. So the whole country was locked down for about 8 weeks or 10 weeks. But the dormitories were locked down for much longer. They were not allowed to leave the dormitory. They were stuck inside. Food was provided to them. Healthcare, medical doctors used to go there for any urgent medical conditions. But they were not allowed to leave the dormitory at all, unlike the normal population of Singapore who could go out to work. So that was considered discriminatory. Therefore, the mental health of these migrant workers also suffered quite a bit. So these migrant workers are actually living on their own. Their families are back in their home countries, Bangladesh, India, China. At that time, we had Delta wave occurring in India, high mortality at that point. So they were like facing bad news from there. They could not go back, and then they were locked down here, restrictions on their movement. A few psychiatrists in Singapore got together as a group, and we identified people who could speak Tamil. We found counselors and psychiatrists who could speak Bengali to Bangladeshi workers, and also Chinese psychiatrists who could speak to workers from China. We did Zoom calls with them almost 2 or 3 times a week. We had someone to facilitate the Zoom calls in the migrant workers in the dormitories. So we were educating them about the symptoms. We were reassuring them. We would tell them that the government was supporting them financially. Medical supplies were provided, food was provided, and then they also had access to Wi-Fi. They could speak to their families back home. It was more like a listening ear to them and to tell them that we are there to help. So that was quite reassuring for them to know that there were actually people who were there to listen to them. And if there were more serious concerns like depression or suicidal kind of behaviors, then we would intervene and refer them to the nearest public hospital. This went on for a few months, at least 6 months. We did this intensive kind of Zoom in-reach sessions with them.
Rajesh, thank you for providing that community service to people who feel isolated and in the middle of a global catastrophe. What activities do you do for leisure to balance your hectic life as a forensic psychiatrist?
My passion has always been cricket, so I played cricket for a long, long time, and we also watched cricket together. Recently, we had the Champions Trophy where we won. So a few of us went out to bar where live cricket was being shown. We saw the entire finals the whole night.
Does Singapore have those stadiums where cricket is played?
Cricket is not a major passion here. It's mainly soccer and other sports. Cricket is mainly played among migrant workers because of the Indian and the Bangladeshi population, right? There are expats, British and Australian expats who are also interested in cricket. So we have a community, a local community, and then we have a small group. We play at a local field. Yeah, it's not like a major kind of cricket. It's like a tennis ball cricket what we play just to play pass.
Oh, okay. It's more for fun.
More for fun, yes.
What's the one thing that you would like to change in how psychiatry is practiced or how psychiatry is taught?
We've been discussing this for a long time. The exposure to psychiatry in medical school is quite limited. It's only about 3 to 4 weeks in the curriculum. It's usually more to the chronic condition like schizophrenia or bipolar, which is not commonly seen. It's only about 1%. Schizophrenia is 1%, bipolar is 1%. But the more common conditions we see are depression, anxiety disorders, OCD, alcohol dependence, psychiatric conditions which can occur in medical conditions like dementia, delirium. The exposure should be much more intensive so that medical students are aware that these conditions are more prevalent. So I would focus on these aspects if I was designing the curriculum for an undergraduate medical student.
And thank you for sharing that, Rajesh. Even in my career, I've faced situations in which I was not able to identify something as simple as a heart attack because uh, that is not something that we are really taught about in medical school. So I completely identify with that. And lastly, what legacy do you want to leave for your students and for forensic psychiatry?
Legacy, yeah, it's a very big word, but I think to pursue forensic psychiatry is not an easy path, but it's definitely a satisfying path, I would say, because to be a forensic psychiatrist, you have to be clinically very, very astute. Every word you write in your report, which goes to the court, has to be defended. So you can't really come to a diagnosis without giving the reasoning. You need to be evidence based. Your assessments to be very comprehensive. If you are a good forensic psychiatrist, you are actually a very good clinical psychiatrist, which means that you've been able to obtain all the history properly and come to a proper diagnosis. There are people who may find that the scrutiny of being in court and being further examined by lawyers is quite challenging, but some people find it interesting because you are able to reason out and explain your basis in a court, your duties to the court. You're playing a part in the legal system as a forensic psychiatrist. So I think that is something which needs to be valued in the administration of justice.
Thank you for giving us a glimpse into your professional life. It was a pleasure talking to you, Rajesh.
Thanks, David, again for the invite. Happy to speak to you and really connected to you after so many years.
And that's all for today, folks. Thanks for tuning in and subscribe for more.